Good morning, early afternoon, everybody. We're going to give everybody just a few more minutes to get logged in, and we will get started with our September town hall here shortly. All right, well, we will go ahead and get started. So, thank you guys for taking the time out of your day to join us on this wonderful September 30th of 2024. Hopefully, everybody on this call weathered all the storms and all the different areas just fine. There were definitely some hard hit areas, which will impact some of how AEP plays out. So please keep that in your head as we go through our town hall today. But with me, I have Brandon Hall, and we are going to go through just some quick little housekeeping items to make sure that you guys are able to have the best AEP possible. And first step to having the best AEP possible is making sure that you're certified. I always kind of like to bookmark today as the last day for certifications. So if you are going to sell for 2025, please make sure that all your carrier certifications are done. And you can check that by going to each carrier site and making sure that you show as ready to sell. If you need help or have questions regarding that, please contact your sales development specialist here at National Contracting Center. They will either walk you through it or get with contracting and onboarding to make sure you are indeed ready to sell with all the carriers that you either have business with or are new to your area. The second step is to make sure that all your supplies are ordered. If you need paper supplies, those orders need to be in as quickly as possible. At this point, I do suggest that you work with your local broker manager to get supplies if you have not already ordered them. So you do have to be ready to sell in order to submit your supply order. But if you're just now getting certified, reach out to your local broker managers with each carrier, and they can give you some supplies to tide you over for a few days until your carrier ordered supplies get there. This next thing is a big deal. Marketing material in hand, and that means your marketing material. Do you have your business cards? Do you have your flyers? Is everything up to date with any communications, any branding messaging that you want portrayed for this year? Do all your materials have continuity in how they look? Do they all show the same name? Is it your personal name or your agency name? This is extremely important. Branding you and or your agency is key to your success. The more people see something, the more likely they are to call on that thing. So please make sure that you are using personalized marketing material that shows your brand. And whether you're using just your personal name or an agency name, make sure everything across the board has that same messaging, colors, logo, etc., so that people start to recognize you and what you do. This next thing is very important this year. Communicate with your clients. Clients have questions. And this is a heavy, heavy question year for multiple reasons. The Inflation Reduction Act has a ton of effects on PDPs. It will also have some effect on the MAPDs, and clients are hearing about it. Your customers are hearing about that. Therefore, it makes them have questions. Your customers are hearing that in some areas, certain plans are leaving. They are getting their carrier communications through their annual notice of change to let them know what is changing. They have questions. If you're not communicating with them, somebody else is. So please make sure that one of the top things on your list is to communicate with your current book of business in addition to looking for new business. You do want to make sure that you have appointments made. Appointments are going to be key. Scheduling is going to be key to a successful and manageable AEP. This year, we do, especially in our high disruption areas, suggest that you set up events. You can do events on semi-short notice depending on the type of event. But if you want to market to your current book of business and you can make, 30, 40 phone calls a day for 3 days, you can set up an event in under 5 days, but you have to be ready to put in the work. So event setup is a great way to get you in front of multiple clients at the same time. If you're in a market like Georgia, certain areas of Mississippi, just random places have big disruptions this year, but Georgia and Mississippi were some of the hardest hit areas. If you're in some of those areas where plans have pulled out, carriers have left certain counties, these events are key to get you in front of as many people as possible, as quickly as possible. And then partnerships. Local business partnerships are going to be very important. This is going to help you get in front of new clients. Getting your name out there, again, your brand, and letting people know what you are able to do to help people who are on Medicare make the best decision for them for their plan for the upcoming year is going to be key to picking up some new business. Brandon, do you have anything to add there?
The only thing I'd add, Courtney, is back to the marketing material in hand when you were talking about having your own personal marketing material. We have an asset library that was launched earlier this quarter on nccagent.com. So on our website, there is an asset library where we have forms that you can fill out that put your information in already planned documents. So flyers, mailers, a mock-up of a postcard. Now, we can't print your postcards for you, but you can take that to Staples or somewhere like that and have that printed. If you need help with that, or if you need an idea, that asset library is a very good place to start. Or reach out to one of us on the marketing team here at National Contracting Center. We'd be glad to talk with you about your branding, your colors, your headshots, those types of things. We definitely have a team here to help you, and we want to get that in your hands as quick as we can. This close to AEP, it may be we can help set up the draft, and then you have to take it to a Staples or a print Office Depot to get it printed. Sometimes you can order from Vistaprint, but shipping times this close to AEP, we may not get it in your hand in time. But just wanted to throw that out there. And also appointments made. If you're not using a scheduling software, a scheduling software can help save you time by what am I trying to say? There's a website out there. I think they have an app too. It's called Calendly, that you set it up, you link it to your email calendar, and then your beneficiaries go on and they select a time that you're available, that they're available. If you're not available, it won't show up on that time and they can't book it. You can send them a link. You can put it as a link in your email signature, and they just click on it, select a time. That can save you a ton of time, unless you have someone that's making phone calls for you, setting up your appointments. But if you're a one-man show, one-woman show, and you're setting up your own appointments, an online scheduling software can help you save a ton of time, especially this year, as there's going to be, like Courtney said, tons of people having tons of questions and needing to talk to someone. But on this slide, that's all I'd add, Courtney.
Well, you know what? I think you bring up a great point. In addition to Calendly, Retire Flow is going to be a
Yes.
great tool for a lot of people. Retire Flow will allow you to send a link or a QR code to your clients, and then they're basically just getting on that link, which is directly tied to you, and filling out their information. They can even sign a scope of appointment. So they can input their doctors, their drugs, sign that scope of appointment, and send all that over to you as they make their appointment date and time. So definitely quite a few things out there this year to make life a little bit easier in what could be a very hectic year depending on your location.
Yeah, and if you want extra information about Retire Flow, we actually have a webinar that we did with them on our YouTube channel. Just go to YouTube and search NCC Agent, and the Retire Flow webinar is there. They walk through a demo of how it works, so they go from start to finish, and it'll give you all the information that you need on that.
So disruptions, you've heard us talk about disruptions a good bit already in just 10 minutes of this call. But there are multiple areas that are seeing some disruptions. Just a few are really crazy hard hit. But you really have to look at your specific area and what is affecting it. Are there carriers or plans that are leaving? Are there new carriers or new plans coming in? A new carrier can do just as much damage coming in. And by damage, it's really a good thing, right? It's new business. You're putting people on new products. There's new opportunities for them to get good or better health care. All these things are, even though they're disruptive, they should be viewed as positives. It's going to make you work a little bit harder. But if you're out there really doing what is best for your clients and trying to pick up new business, a year full of disruptions can be hugely profitable for you in the long run. And if you're a brand new agent, a year like this really gives you an opportunity to make a name for yourself rather quickly. So keep your eye on your carriers, your plans, especially this year, the plan numbers. I cannot stress that enough. With Aetna, we saw them pull out a good chunk of plans like their Freedom Plus, their Value Plus, their Signature Plan. And in a lot of counties, they came back in and reopened a plan under the exact same plan name with new plan numbers, which can be insanely confusing. So make sure your plan numbers are your focal point this year, not the plan names. If you're selling Humana, almost everything's Gold Plus. So you're used to looking at the plan number. You will need to have that same stance when it comes to Aetna this year and more than likely moving forward as well. If you have a lot of DSNP clients on your books and you're kind of used to an easier AEP, this year you're not going to have DSNP enrollments are being limited, and AEP and OEP are going to be the two times in which the vast majority of DSNPs are going to be able to change their plan. So you really do have to view DSNPs as normal Medicare Advantage enrollments this year without the additional special election. And that's just going to help you out in the long run. If you have lots of clients on a standalone PDP, if you have lots of clients on a standalone PDP that is no longer paying commissions or renewals, it's probably something that you want to look at moving. And whether or not you move them to a new standalone drug plan or a Medicare Advantage plan, maybe there's somebody whose supplements have seen quite a few rate increases. That might be somebody you want to now put on a Medicare Advantage plan, which is going to be a lot more education on the front end. These are people that you need to get in front of during AEP. People on standalone drug plans do not get an OEP election. OEP, sorry about that. My dogs are rather excited. But OEP is only for those on Medicare Advantage plans. So if you have clients who are just seeing a big change in their drug plan, or like I said, that drug plan is no longer commissionable to you, you have to utilize AEP to make those changes. So please keep that in mind. If you're in an area where there's network issues, in Tennessee, we're seeing Vanderbilt drop from a lot of carriers. If you're in an area like that where a hospital is very much relied on and they have left the network of some carriers, that's a big disruption. It's also a big opportunity for other carriers to pick up a lot of business. So again, all these things you need to be aware of. You have to know how you're going to pivot and help your clients. But overall, disruptions can be vastly positive. Um, they're a great way for you to affect change in people's lives, especially those people whose agent may have been a call center. Because guess who's not reaching out? Call centers are not reaching out when there are plan disruptions, but you can. So let's tie that back in to the branding and getting your name and your logo and your colors out there so that people recognize you as a Medicare aficionado, somebody who is there to help them and answer their questions and point them in the best direction. This is a year where if you have that type of reputation behind your name, you will be covered head to toe in business through AEP and OEP. Here is one of the catalysts to that, the Inflation Reduction Act. And I'm sure you guys have heard of this. I'm sure you have attended webinars with this. I like to keep things as simple as humanly possible. So, what does the Inflation Reduction Act mean? It means that everybody who is on a Medicare drug plan, be it standalone PDP or drug coverage through a Medicare Advantage plan, their out-of-pocket cost for their drugs is capped at $2,000 a year. That includes any applicable deductible. If the plan has a deductible, that deductible applies to your $2,000 out-of-pocket max. The Inflation Reduction Act is also allowing clients to opt into a payment plan. It's called the M3P. It's a little bit frustrating because carriers are still trying to figure out how exactly it's going to work, but that's okay. That's up to the carrier. That is not something that you have to worry about. You need to worry about these next three little bullet points right here. What does it take for somebody to get on to a payment plan? First off, they can opt in at any point during the year. They only need one high-cost drug. That's one drug with a monthly payment of $600 or more. That allows them to opt into the payment plan, and it evenly spreads payments out through the course of the year. So if you just, let's say somebody opts in January, they know they're going to hit their out-of-pocket max of $2,000. They have 12 months in which they can spread that payment out. It comes out to like 165, 167, somewhere in there a month. That's not bad. That's something that is much more palatable for a senior or for somebody who's a Medicare beneficiary to figure out than it is $600 lump sum. $600 lump sum, a lot of people don't pick up that med. $165, they can probably figure that out. The biggest difference with somebody who is on one of these M3P plans is that they do not pay at the pharmacy. They pay through the carrier. That in itself is why you don't want to get into the minutia of things behind this. If you know Sally has a drug that's going to cost her $700, you just say, you know what? I understand you have a really high cost drug here. When we were going through all your drugs and your doctors, this drug popped as a very high cost drug. I suggest, Sally, that you reach out to whatever carrier you're enrolling her on and immediately set up their payment plan. Let the carrier talk to them about how it works, how they need to remit payment, and how everything is going to move on from there. Billing is not our job. That's not our strong suit. We're salespeople, and we're trying to do what's best for the client. And what's best for the client in this case is you letting the carriers answer that question. It's brand new to this year. As they work out the bugs and the hiccups, etc., you'll be able to answer more and more questions. But this year, referring to the carrier is going to be key to making sure that your client gets the correct information.
Hey, Courtney, we did have a question come in on the amount of the drug. Is that the retail cost or the co-insurance amount for the customer?
I don't have that answer. I will get that answer. My guess is going to be the co-insurance amount, but I am not positive on that. So I will get that answer for David and send it out.
Yeah, I've in everything I've read so far, I haven't seen a delineation of that yet. So we'll definitely get that for you, David.
Any other questions around this? You guys are able to come off of mute. So thanks for breaking our question egg there, David. But anybody is more than welcome to verbalize questions or type them in the chat as David did. Cool. You want to pop the next slide?
There we go.
On the copay for the diabetic, that's $35. Does the $35 go against $2,000, or the cost of the diabetic medicine, which is like $200 or $300, goes against the $2,000, or do they both?
$35. It's the out-of-pocket cost.
Okay. Thank you.
Yes. Okay. And this is kind of what I've been alluding to. This whole webinar is this year is a sea of opportunities for so many different reasons. And some opportunities I may not have even touched on. Maybe your area is a little different. But how do you make opportunities work for you? Well, you start by scheduling out your days. You got to have some version of a plan. So schedule out your days as much as humanly possible, but understand that not every schedule works out. You're going to have to pivot. But if you have a good general game plan, you're going to be much better off than somebody who's just out there winging it. Brand yourself every chance you get. And I know I harp on this often, but it's the truth. Brandon's in our marketing department. He can attest to that. The more you see it, the better off chance you have to actually use it. Use events to your advantage. Get in front of as many people as possible, as often as possible. It helps build your brand. It helps build your trust. And it does allow you to communicate with more people all at once, which just absolutely makes the best use of your time possible. Be in contact with your carrier broker managers and your FMO partners. You guys are out there, you're doing the hard work. We're here to make life as easy as possible. So if you have a question, call in. Don't hesitate to ask for myself or any member of the National Contracting Center staff. We are all here to help you, from your sales development managers to our marketing department to contracting and onboarding. We want to do whatever is best for you to make life a little bit easier, especially during AEP. The carrier broker managers are out there doing the exact same thing. So if you don't have a list of your carrier broker reps, give us a call. We can help you get that together. They're kind of your phone a friend. If you're out there in the field and you have some questions, the carrier broker managers are going to help you out along with your FMO partners. Ask for referrals every single time. Don't pass up a chance to ask for a referral. They're probably your highest rate of return on a lead. They're, typically free, typically going to sell. So make sure that you're asking for referrals. Know the plans that are available. Knowledge is power, especially, in years like this year. So make sure that you're studying up. If you are using a tool like a Retire Flow, or a Calendly, or maybe you have an appointment setter or an admin at your hands, do your homework before you go into your appointment. Have the drugs run, have the doctors run, limit your choices for your client so that it's easier for them to make a decision based on their needs. And this one is huge. Use technology. Brandon brought it up, with the use of Calendly. I tagged on to that with the use of Retire Flow. We offer Enrollment Central, which is Sunfire driven. Use these tools to your advantage. E-apps are much, much more simple to do. They're quicker. They're easier. They don't have bad handwriting. All of us, especially as we get tired, all of a sudden we turn into chickens. We can't read our handwriting. Our signatures look like doctor signatures. Technology doesn't allow for that. Use that to your benefit. Limit your RFIs. Limit the need to go back and ask your client for additional information. Anything to add, Brandon? Lord, I'm sorry.
I answered just about everything. I would say too, on top of that, make sure you're familiar with your carrier portals as well. Sometimes there are situations where Enrollment Central, while it is, in my opinion, one of the best platforms out there, there are times where things go wonky with technology. And sometimes Enrollment Central doesn't work, but the carrier portal will work for you. So make sure you log into those prior to an appointment. You don't want to, some of the carriers require an attestation to use their e-app. So you don't want to be in an appointment, log into the carrier portal and not be able to use it. So to Courtney's point, you want to make sure all of that is taken care of prior to. Something else I'll say, and this is something that a couple agents and I talked about the other day. If you're going to be a road warrior, this AEP, and get out and go visit people and not have them come to you, make sure you service your vehicle. It's something we don't talk about a lot, but you might want to make sure the oil's changed, the belts are good. If you need tires, do that. But if you're going to be out and about on the road, you want to make sure you get there safely. So make sure all of that is tuned up before you get out on the road.
Absolutely. I have to leave this afternoon for an agent event. And the first thing I did this morning was fill up my car. So try to make life just a little bit easier. To me, the worst thing to have to do in the morning is get gas. So if you prepare the night before, it's just going to make your day a little bit more simple. And this all plays into our next slide here. And it's what happens if your schedule falls through? Do you just sit there in a dark room and say, well, what do I do? That was a waste of a day. No. You make calls. You visit local businesses. Work on your social media. I can't help you, but Brandon can. Samantha can. Whoever Brian is that I yelled at earlier, they can. But do something that's going to help your business. Prepare for your next appointment. Verify your schedule for tomorrow. Check app statuses. Get yourself organized. And this is something you're rarely going to hear people say. But if you need a break, take a break. You're no good to anybody if you can't see straight, if you're not thinking clearly, if you're whatever, if your brain's somewhere else, take a break. You're not going to be able to help people if you need help yourself. So rest is very important. Making sure that you take time to grab something to eat, grab a water. Sometimes you just have to sit in silence, but take those breaks when needed. If something falls through, do something to set yourself up for a better next appointment, next day, next whatever. But things are going to fall through. People aren't going to show up. You may have thought something was going to be, a lay down sale, and it ended up not being. But just remember, sometimes you just have to shake it off and move on to the next item. These are all great ideas as to what to do if your overall schedule might fall through. But outside of that, guys, we're going to open it up to your questions, comments, concerns. I know it's a busy time of year, so I want to be as respectful of your time as possible. And I also want to make sure that you get the information that you're looking for. So anybody have any questions, comments, concerns?
Hey, Courtney, there was another question in the chat that asked about Sunfire recently rolled out a customer intake form, which is very similar to Retire Flow. It's not the same because Sunfire built their own technology. But it's the same thought process, the same information gathering. I saw it in the testing site recently. I think it may be on the live site now too. I've not tested it to see what it looks like compared to Retire Flow, but I know they took the thought behind it from Retire Flow and then built their own, if that makes sense.
And I know less than that. So if you guys
what I'll say too, sorry to interrupt, Courtney, was Retire Flow seemed to integrate into external CRMs. I'm not sure that the Sunfire intake would integrate into anything other than Sunfire. So think about it along those lines. If you're looking to get information to keep in your CRM, Retire Flow might be a good option. But if you're just looking to get the information for applications, then Sunfire Enrollment Central might be the way to go. Either way, it's a great option. I'm glad we have both options out there to go ahead and be able to get this information prior to meetings, right? So you can send that link out, go ahead and get a list of doctors, list of prescriptions, use the scope of appointment prior to. Anything to get ahead of the game, I'm all for. But to, I guess, sum up my long-winded answer here, David, I haven't compared the two just yet.
I was on the phone with, or I guess I was on a podcast and saw it, and it looked like it was going to have drugs just like Retire Flow. Mm-hmm. They said the date was going to be the 26th, so I tried it on the 26th, and it allowed me to do a scope of appointment, and that was it. It didn't go in and take me into grabbing the drugs, but what the representative talked about is, let's say you had 10 drugs and they listed 12, it would keep the 10 and add the 2 additional. But I have not seen it in the live system. So that was why I was asking, because when I ran it, it just took me to the SOA. Sure. And not to the drugs. And I was hoping to find out if it included the drugs, because it's an additional step with Retire Flow to pull in the drugs. Yeah. If I had it in Sunfire, it would automatically do it for me, and I could go click quote and I'm done, instead of spending that 30 minutes of moving the drugs over. Sure.
As with anything technology wise, when they roll it out, there's still the bugs and whatnot. So hopefully, I would say by the time AEP gets here, they'll have everything ready to go. I know that's not a comforting answer as we gear up for probably one of the busiest AEPs we're going to have. But rolling it out this close, I know they've got a dedicated team specifically. I'm teamsing our Enrollment Central guru behind the scenes right now, and she's saying that they've got a dedicated team working to get that up and going just as quick as possible. So it's possible that they didn't have everything ironed out, when you jumped on, but hopefully it gets out live. If I find anything out within the next day or so, David, I'll email you personally.
Great. And it's really looking at it from a perspective of there's a cost to retire flow. It's slick. I like it. But Sunfire captures it all, and it would save me time.
Sure.
So with Medicare.gov necessarily not working all the time, and you have to change a lot of Part D plans, you can go to carriers and put them all in there, each carrier. How do you recommend on doing the Part Ds then, when the times come to do it? What site should you use, or do you recommend?
So that's really going to be preference to the person. Unfortunately, a platform like Sunfire, Connecture, most of the non-commissionable plans are suppressed. So you're not going to be able to see anything that you can't get paid on. And that's not our choice. That's not Sunfire's choice or Connecture's choice. That is actually the carrier's choice as to what they show on those plans. So you may want to use medicare.gov so that you can see, especially all standalone PDPs.
Sure. Okay.
And then, verify on a carrier specific website.
Okay.
Anything else, guys? Cool. Well, I really appreciate your time as always. We appreciate all the hard work that you guys do. If you need anything, please reach out to any member of the National Contracting Center staff. We are happy to help you in any way that we can, and we wish you a fantastic AEP. We will talk to y'all soon.